Hi, Emmett Murphy here, and I'd like to talk to you about putting the right person in the right place for the right reason and the right cost to guarantee patient safety and quality in healthcare. Today we're here facing a tremendous challenge, a tremendous range of challenges, and I'd like to invite you to join us in an introduction to our new series, which is about right person, right place, right reason, right cost, right now, because it is the central issue in making it possible to create a patient-centered environment in hospitals and medical practices, etc. Patients come to our organizations because they want to see you. They're there to be helped. And unless you are in the right place at the right time, etc., it isn't going to work. And the same for your people. Now, what does this involve? Well, in the introduction, what we're going to do is cover the issues of complexity, alignment, and putting it all together. Now, complexity is the central issue facing healthcare today. With all the demands and everything else, and the technology, our structure itself is complex. With all of these things, we live in the most complex work environment in the world. There is nothing like healthcare, whether it's in America, which is the most complicated, in Canada, in Ireland, England, Australia, any place. It does not matter. It is complicated. And it centers around the individual worker and the team. And it is that which we have to focus on if we're going to get control of our lives. Now, what are we going to discuss besides complexity in this first program? The issue of alignment. Alignment is the solution to complexity, and then we are going to talk about how to put it together through four basic issues which dominate, which predict whether we're going to be effective. Why do we know these four issues are key? Because of a tremendous interesting and comprehensive study we've just completed. It's coming out with the Institute for Diversity of the American Hospital Association, should be available this next month. But in this study, we sought to identify what is most critical to the welfare of patients and of our healthcare workers today. And we must be able to generate quality and safety, but we must be able to do it profitably or it all falls apart. And to do that, we must manage complexity and align ourselves more effectively. How do we do it? Through mastery of four basic skill areas. The first is alignment of the work. How do we put work together in the proper way, in the most effective way? Well, the research tells us how, because there are others in our field. Over 370 hospitals are involved in this, and over 100,000 people, and we have a pretty good handle on what best practice is for high quality, high profitability organizations. We know it's very critical to align the work. Then we must align motivation and wellness, and they go together. Our wellness is a problem in healthcare. Our absentee rates, our sickness rates are 150% on average of what it is in the private sector. That means an average nurse is sick more often, 150%, 1.5 times as much as a teacher in schools. This is not a good thing. And when we talk about treating patients with quality and so forth, we've got to start with ourselves. Apartheid does not work. So we're going to talk very specifically about the motivational and wellness profiles of healthy organizations and how we can resemble them. Then we're also going to talk about team relationships and the science of that and how to make those more effective. Then we're going to talk about aligning leadership, aligning the work, aligning motivation and wellness, aligning team relationships, aligning leadership. And leadership centers on the successful implementation of two very basic and powerful skill sets. And we're going to talk about those very specifically, how they deal with 60% of this alignment issue. So join this introductory program. It's 45 minutes long. It's the first of the 5-part series. So you'll want to, treat it like a regular program. I tried to put this together pretty rigorously. The second thing is, if you feel that's enough, you'll get a good introduction. Fine. We're happy to share that with you. You may also think that you want to look at one or all 4 of the others as well as the concluding wrap-up. So if you do, that's fine also. They'll be available. So I look for you to join us. You can look for it at scheduled times or 24/7 by clicking on the link here, and that'll put you right into that introductory video. Thank you very much. Emmett Murphy, signing off.